Well, good morning. Good morning. It's 8 o'clock. It is June the 12th. It is a wonderful Saturday morning here in sunny South Carolina. Thank you for joining me this early on a Saturday morning. I am super excited to be here. It is my normal weekly live stream to talk about dementia and dementia-related topics. There are a few ways you guys can connect with me if you are interested later on. Today we're going to solve a few problems. I'm going to answer a few questions for people regarding dementia and dementia-related behavior. So if anybody has any questions when you hop on, please throw them in the comments. I do answer questions from the people who watch the show, and I'm super excited to be here this morning. It is early. I'm just putting in my contact information real quick, trying different things, different ways to see what works. You never know. Whoops, I'm struggling with my computer here. I am very excited to be here on this Saturday morning. How are you guys doing? Has it been challenging this week? Are things going well? I'm putting in my contact information if you want to join me. If you're watching this live in a couple of minutes, throw out live. If you're watching this on replay, please go ahead and say replay. If you have any questions, particular questions for me, I would welcome them. Thank you for joining me. It is early on a Saturday morning. I'm still working on trying to figure out when the best time of day is to do these, but I tried it a different time and it didn't work because it didn't work in my life, and so I picked this time because it works better in my life. But life is good. So this is welcome to the Baffled Brain. Good morning. Welcome to the Baffled Brain. Since this is my weekly hour-long Facebook Live that will teach you everything you want to know about how to manage dementia. Today is June the 12th. It is episode 28, I think, and I am your host, Lizette Klute. I am an occupational therapist from Think Different Dementia, where we believe caregivers deserve reliable and accessible answers to questions. And providing caregivers actionable strategies and reliable information gives them and the person with dementia their best quality of life, improves your relationships, and delays that person's decline. So welcome. I have my handy dandy little my handy dandy little sheet with questions. So the format of this program is to answer questions for you. I'm here for you guys that are on live particularly, but since everybody doesn't usually jump in immediately, I do have a few questions, and I thought I would, so what I try to do, just if people are interested in knowing, actually go through the site, and this larger dementia group, I go through the site and I pick a few questions that I think I can answer, and then I go ahead and answer them. So here was one from our own Moira. Moira and I dialogue a fair amount outside of this group. There are a couple ways you can reach me. You can message me, Lizette Klute OT. Anytime I will answer questions. So Moira is in this group, and Moira is pretty open about the fact that she herself has vascular dementia. If you're on Moira, I welcome you. Thank you for joining. And she had a question, and so here was her question. Okay, do people with mainly early stages of dementia, and she said, I'm not sure if it affects all types of dementia or just one, or if people at different stages, do people misconstrue, does the person with dementia misconstrue what other people say to them, or get cross or angry quicker than before? For example, and this was her example, she went to go stay with a friend, and the friend admits now that she was not up to having Moira stay with her, but felt obliged to carry on. And then suddenly she said that Moira was argumentative, that she got things totally wrong, and that what Moira thought was funny wasn't, it was sarcastic and uncalled for, and that she got things totally wrong. She would say, for example, you want to stay here? She would say, do you want to stay here or go for a walk with the dogs? But Moira said that she's not a walker, isn't fit, and that her friend wants to go walking through the forest's rough grounds, etc., and she only walks on paths because she has partial eyesight. And so her friend lives in the country and has two dogs and walks really quickly. And then Moira told her she couldn't. It wasn't something that she enjoyed, and her friend snapped with her and said she was slow-witted, and it didn't matter whether she lived in town or country. She needed to walk in order to to get fit. And then that Moira was just making excuses. And then she said, you can whittle this down to, does someone with dementia take advice properly or get unreasonably argumentative or defensive? And so I thought this was a great question. And Moira, I'm so sorry that your friend doesn't understand dementia. Dementia, in the earlier stages of dementia, and I know from conversations, and like I said, Moira is pretty open about the fact that she has vascular dementia, and is in the beginning phases of vascular dementia. Moira, your situation, what you ask here is, do people misconstrue, does a person with dementia misconstrue what other people say to them? And I'm going to explain it in this way, and I know that it is very hard when I can only imagine, honestly, I can only imagine how hard it must be to know that you have the beginning stages of dementia. I can only imagine. I have not been in that situation. So Moira, my heart bleeds for you. I'm here for you in any way I can. But to answer your question, Moira, so what happens with people with dementia, right? And we talk about this a lot, right? The outer layers of the brain are like are the parts that control our executive functions. And if executive functions are things like emotional regulation, it's things like anticipating consequences of doing things, it's things like being able to plan and organize and understand the higher level things. It's the stuff that we develop when we are getting towards our teenage years. So we talk about retrogenesis, right? What is retrogenesis? Retrogenesis is retro means returning to, genesis is the beginning, and so retrogenesis is the theory that and Dr. Reisberg talks about the 7 stages of dementia through his functional assessment staging tool, where you start with, the highest levels and then go back to stage 7. Well, the earlier parts, and the reason I bring these two things up is because if you understand retrogenesis, and if you understand the stages of dementia following the phases, the retrogenesis model, you start to understand what happens at the beginning, which is the loss of executive functions. So Moira, to go back to, do people with early stages of dementia or types of dementia, do they sometimes misconstrue what people say to them or not, or get cross or angry quicker than before? The answer is yes. Unfortunately, when a person is living with dementia, as their executive functions, as I said, the ability to manage your own emotional regulation, that becomes impaired, that becomes challenging. So it is not uncommon for people with dementia to start to misunderstand or misconstrue what other people are actually saying to them. And so when that happens, it's easy to, because the person is losing their emotional regulation, which is the executive function, or one of the executive function, as they're losing their ability to control their own emotions, it is easy to become quickly angry. It is easy to become quickly frustrated. The person with dementia can lose the ability to have what we call frustration tolerance, right? Everybody has a modicum of frustration tolerance. Normal people have better or worse frustration tolerance depending on the day, right? I say this frequently. Normal people's cognition fluctuates, and in a normal day, like if I had a truly awful day at work on Wednesday, either Wednesday or Thursday, nothing worked out. I lost documentation. My patients weren't, I couldn't see them at the times I needed to see them in order for me to have a smooth day, and I was short on the trigger. So normal people, when we have a hard time with our day, have trouble with our executive functions. So I hate to say that, but sometimes, Moira, we have to put ourselves outside of the situation and step out and say, am I being too short on the trigger? Is my friend right? Have I started to show some of these signs and symptoms of not being able to control my own emotions? And then the other part of the equation is we all are creatures of habit, right? We all are creatures of habit that we all have predispositions to our personalities, right? My predisposition to my personality for my whole entire life, and something I have to work at, it doesn't come easy to me, is to control anger. I can get angry at the drop of a hat. And so as we lose that filter, right, our executive functions is our filter. It becomes very easy for whatever was inside to just spill out. So I know all of us have a filter. I have a filter. When my filter is working good, you don't know what I'm thinking. When my filter is not working good, Moira, you know exactly what I'm thinking, exactly what I'm feeling, exactly where my emotions are. So sometimes people with dementia do become a little bit more argumentative. Sometimes people with dementia do become more emotional because they cannot control their emotions. So yes, my heart bleeds for you. I'm here for you. You know how to reach me, Lizette Kluta OT on Messenger. You can join, Moira is already in my private Facebook group called Think Different Dementia. So I do a second program like this on a Tuesday or Thursday night. I'm kind of playing with those 2 evenings right now, where I'm trying to do more topical things. I'm looking for people to ask me questions. Good morning, Ralph and Eunice and Lori. Thank you so much, guys, for joining me. I am so happy you are here. I'm just gonna, Eunice is from South Africa. If you've watched me before, I'm from South Africa originally. I'm just gonna say hi to my friend in South Africa. Eunice, goeiemôre. Ek weet dis middag daar. Happy Saturday. Dankie dat jy weer hier is. Ek hoop dit gaan goed. Lori, welcome. If you have questions about your husband, please throw them out here. Ralph, if you have questions, Sir Ralph, you always call me Lady Lizette, and thank you for being here. So here's another question. If nobody has a question in the chat, I'm going to just pull up another question. And the first one was from Moira. Oh, this was a great, oh, Lori has a question. Let's break and do Lori's question. What are the symptoms of end stage? My husband is sleeping more but still eats. Sit in the wheelchair, holds your hand. He's not responsive, laying in bed. Will he waste away? Lori, my friend, you and I have talked a lot. I know that this is hard to hear and understand, but your dear husband's already in the late stages of dementia. And you know, we started to talk about this in when I was talking about Moira's question, right? When you look at the functional assessment staging tool, which is the 7 stages of dementia, which is a retrogenesis model, when you look at the functional assessment staging tool, right, your husband is already kind of in the last stage of dementia, right? What are some of the hallmarks? What are some of the characteristics of the latest stages of dementia? Is the inability to be able to hold yourself up against gravity, right? So he can still sit up, but he has to be entirely supported, right? He is going to start to sleep more. He will be able to eat, but his appetite is going to start to diminish. He is going to start to eat less slowly over time. You know, a lot of times people ask the question, do people die from dementia, or do people die with dementia? And Lori, I know off of our previous conversations, I know where your heart is. I know you are a strong believer. I know that your husband is a strong believer. So we all are, you know, we know, everybody knows that most people know this. A lot of people try to suppress this, but we are all going to pass away. Some of us just have a more definitive journey. Some of us just have a more definitive path, right? So some people are diagnosed with cancer. Some types of cancer are curable. Some types of cancer are manageable. Some types of cancer are terminal. Dementia as we know it right now can be better managed and possibly can be significantly, the effects of it can be significantly decreased at the beginning stages. At the end stages of dementia, however, it is a terminal process, Miss Lori. So your husband is in that final stages of his dementia journey. His world will be here, right in front of him, and the term wasting away is not really, it's not that he's wasting away. It's that at the end of our life, our body naturally, if we live long enough with the terminal process, our body is naturally going to shut down. That is what it does. Any person who lives long enough, their body will start to shut down. Some people pass away like this, right? Some people walk out, and like a friend of mine, you know, several years ago in Missouri, had her said goodnight to her husband downstairs, walked upstairs, early 60s, dropped dead of a heart attack, brushing her teeth. And she did not waste away, right? She had a sudden cardiac death. But people who have dementia and live with dementia long enough, back to what I was saying earlier about dying with dementia or dying from dementia, for the most part, people die with dementia. For the most part, they will die with dementia because what's ultimately the thing that had them pass away was they got aspiration pneumonia because they weren't swallowing properly anymore, or they on top of their dementia all of a sudden have a massive stroke, and then they pass away because they cannot eat or drink anymore. So for the most part, most people die with dementia, not from dementia. Now, do some people die from dementia? Absolutely, because they don't have one of these other events that occur. And when that happens, they will stop eating and drinking. their body systems start to shut down. A person can live without food for weeks, honestly, weeks, but they cannot live without liquid for weeks. So as a person is slowly going through this process, it looks like they're wasting away, but they're not really wasting away per se, Miss Lori. He is going to be sleeping more. His kidneys are going to start to shut down. All of these functions are going to start to shut down, and then one day he's going to be, he's just going to either stop breathing or he won't wake up. And I don't know which preference yours would be. I would want to be with my husband. If your husband, Lori, I think if I remember correctly, he is on hospice. I would definitely be asking hospice to let you know when he's closer to that phase so that you can be there if that is your wish. So Lori, I hope that was helpful. I know this is a hard conversation, my friend. I totally understand that. My heart goes out to you. I pray for you. I think you have done a tremendous, you've been a good wife to your husband in a very hard situation. So reach out if you need me. Again, you know how to get a hold of me. I love having you here. Thank you so much. Miss Charlotte, good morning. Did you catch the program I did for you on guardianship in the other group the other evening on Thursday night? For some reason, I can't tag you in my post, so I actually answered your question that you asked a few weeks ago about guardianship in that group in Think Different Dementia. So if you guys are on here and you're not a part of my private Facebook group called Think Different Dementia, where I do a topic at a time, please join. I love having you guys there. Vince, good morning. Vince, thank you so much for being here. I love having you here too. If you have any questions, let me know. Ralph, thank you for being here. You're welcome. I love breaking down the difference. I love explaining things. That's why I'm here. This is my groove. I love to teach, and so I hope I do you guys justice. This is my gift to you. Samantha, welcome. Samantha, if you're not in my group, please join as well. And Charlotte, how do you know what stage of dementia a person's in? That is a great question. There's actually a lot of different ways to know how to stage people, right? There are a lot of different tools. And so one way of staging a person with dementia is called the functional assessment staging tool. And that is actually a freely available tool. Let's see if I can type and talk at the same time. I love that these programs go in different ways. Functional assessment staging tool. It's developed by a gentleman called Dr. Riceberg, and I don't want to download it right now. I just want to copy it and put it in the comments. Okay, so the functional assessment staging tool is a model of retrogenesis. Okay, what does that mean? Retrogenesis literally means back to the beginning. Retrogenesis, back to the beginning. So Dr. Riceberg developed the functional assessment staging tool, and I think it was in the early 1990s. I fly by the seat of my pants, so if I make some mistakes, forgive me. I'm human. I make mistakes. But the functional assessment staging tool was developed. He was a keen observer of people. There was a different staging tool at that stage that he also developed that one, and then he developed this functional assessment staging tool out of that one. So that's one where if you understand the phases of development, right? A baby's born. We know that they cannot hold themselves up against gravity, right? We're holding them. They can eat, they can swallow, they start to make, at the beginning they make no eye contact, they cannot say any words, then they go gaga goo goo, mama dada, they'll hold their bottle, they'll start to maybe hold themselves up against gravity, they're able to, flap their arms, they make eye contact, they can see you a few feet ahead. These are normal stages of development, right? Most people follow the same path from birth to full adulthood, which our cognitive processes, in case you did not know this, actually only finish developing at about 25, right? Which is why 18-year-olds tend to be in more motor vehicle accidents. 18 to 25-year-old young men have higher insurance rates, right? So that's the reason why. So as the person is going through these developmental phases, that's a normal phase. So Charlotte, as people start to progress through dementia, specific types of dementia, more Alzheimer's dementia, but I find most dementia processes follow this. But I think the functional assessment staging tool is more specific to Alzheimer's dementia, but especially if it follows, sequentially. For the most part, people follow sequentially and stage sequentially. Sometimes people will, they'll have an event, something happens, a urinary tract infection, a fall, anesthesia, all these other types of things, right, that can make them kind of look like they're skipping a stage. So the functional assessment staging tool you can use to observe your loved one and kind of see what stage they're at. So that's one way we can stage dementia. Another way that we can stage dementia, and I have to think about this real quick, Medicalc. Another way of nope, that's not the one I wanted. There's another way of staging dementia called and I'm working here, so bear with me. Come on, computer. Well, my computer is just frozen, or it's slow. It's called I want to say it is, oh gosh, I cannot remember what it's called. But I'll throw it in the comments. Oh, here it is. It came back. It is oops, I can't type and talk. Clinical Dementia Rating Scale. So the Clinical Dementia Rating Scale is a different type of a rating scale, and I'm going to put the rating scale in the comments here, okay? And this is a calculator that you can use, and it can show, these are down and dirties, guys. These are not really the be-all and end-all. There are other staging tools too. But the Clinical Dementia Rating Scale, you can use your clinical observation, and you can actually plug in, if you answer the questions, you can plug in and it'll tell you whether a person is mild cognitive impairment, mild dementia, moderate dementia, or severe dementia, okay? So these are some tools that you guys can actually use to help stage people with dementia. Now there are other ways of staging people with dementia where people like I come in. I have tests available. I have tests that I can do with people. I can do them with you. I can do them over the internet. I can do them using a Zoom call as long as you're with your loved one, and depending on what stage they're at, I may or may not use a particular test or a different type of test. So there are lots of tests. Then there are the really highly developed things like the psychometric tests, right? Well, when people get to certain stages of dementia, those psychometric tests aren't I don't want to say they're not valid, or they're definitely valid, but they may not necessarily be the way you want to go, because the person with dementia, the person that you're supporting with dementia's processes may have gone to the point where that type of a test is just too stressful. It's too much for them, and they can wig out. And so definitely we want to, so I don't know, Ms. Charlotte, I don't know if this helped you in answering your question, but how to stage somebody. So you can stage somebody in those ways. So Ralph, you wish you knew what stage your sister with frontal temporal dementia is. She lives in Texas, and the last time you saw her on a video chat, you noticed she had stopped talking. You miss her dearly and urgently want to fly out and see her at the nursing home this summer. Okay, Mr. Ralph. So I am super, super sorry to hear that your sister has frontotemporal dementia. That is certainly one of the harder ones. Not saying any dementia is easy, but there are certain dementias that are certainly more challenging than others, and frontotemporal dementia is one of those. So based on your description, and remember it is just based on your description, my best educated guess, and this is a very educated guess, is that your sister is nearing the final stages of dementia. If you look at the functional assessment staging tool, which is what we're kind of talking about this morning, if you look at the functional assessment staging tool, the later phases of dementia, stage 6, 7, I'd have to go look up exactly which one, is where people start to, like 7, people start to lose the ability to speak. So if your sister is having the, if your sister is losing the ability to speak, she is coming to the end stages of her journey, and you may definitely want to fly out and go visit her. I will get with that in a second here. Miss Eunice, when your loved one faint and fall down, how can you help them to get mobile even if they're bigger than you? Eunice, if you can expand on that a little bit. So first of all, why did they, the first thing when I see faint and fall, the first thing that comes to my mind is, why did they faint? Was it blood pressure? Are they on too much medication? Are they dehydrated? What happened that made them, when they stood up, faint and then end up on the ground? And when you say get mobile, or do you mean get back up off of the ground? Because I can certainly teach you how to get somebody back off of the ground if they have fallen, even if they're bigger than you. So I would love for you to just expand on that a little bit for me, and then I'll come back to your question, okay? So Ralph said, can I touch on or explain the hereditary factor of Alzheimer's dementia? Your mom passed away with dementia, your sister has it, and 2 of your aunts currently have dementia. And why do women tend to be impacted by dementia more than men? Now that is a really great question, and I'm flying by the seat of my pants. There are types of dementia, and you know, if I misspeak, you guys have to understand that I literally go by my knowledge base, and sometimes you know, I have slept, and I definitely don't always remember facts. I'm human. I don't always remember facts as well. So Alzheimer's dementia, we'll start with Alzheimer's dementia. So Alzheimer's dementia has 2 parts to it. There are 2 components to it. Some people have a more hereditary type of dementia because they carry the APOE, which are the genetic, that's the genetic part of dementia. It's APOE, I think it's APOE 4, and like I said, if I misspeak, forgive me. So those people carry the genetic component of dementia. some people get dementia, get Alzheimer's dementia, that do not have the genetic predisposition for it. So if you go look at the Bredesen, if you go read the book The End of Alzheimer's, which I recommend all of you guys read, it is written by Dale Bredesen. It's called The End of Alzheimer's. There's more and more research. Alzheimer's, and it's Dale Bredesen. There's more and more research, Ralph, that is indicating that dementia per se is multifactorial. Now, what do I mean by multifactorial, right? There's certain disease processes that have one cause, right? A child who is born with type 1 diabetes, whose pancreas is not working correctly, there's one cause for it, right? Somebody who has appendicitis, right? Your appendix is inflamed and boom, you have to have it taken out. It has one cause, right? Or pneumonia, a true pneumonia because of an organism. That's one cause. More and more of the research is indicating, Ralph, that dementia is multifactorial. And Dale Bredesen, in the book The End of Alzheimer's, has identified, I want to say 36, if not more, factors that contribute to dementia. There are things like inflammation, which is why you control your diet and why you control all of these external factors to try to decrease your risk for developing dementia. If you have not, the earlier we start to do this, which is why I'm doing it now, I'm 50, I'll be 51 in September. So there are 36 different factors. Inflammation, blood sugar, toxicity. There are all these different factors that can contribute to dementia. The hereditary component of it is one, and so some people carry one of these genes, some people carry both because they inherited it from their parents. But just because you have a genetic predisposition for something does not mean that you are going to get it, especially if you look, there's a study called the Nun study, and briefly what that was is they did some research over, oh gosh, I want to say it was 30-40 years on a group of nuns in a obviously in a nunnery, a group of nuns. It's called the Nun study, where they when they died, these nuns gave their bodies over to science. And what they found was there was this nun who had lived for, she was in her 90s. She actually, when they did an autopsy on her brain, she had plaques and tangles, significant plaques and tangles, but she had no overt or external or outward signs of dementia. So she had all the internal signs of what we think of Alzheimer's dementia, which is plaques and tangles. But she had none of the outside signs of dementia. So dementia is way more multifactorial than what people realize it is, right? And it is, you could not, by talking to her, and they did cognitive tests on her for years, for decades. They had decades worth of data on these nuns and some of, what the different factors were. And so when you start to put all these pieces together, Ralph, there is, in Alzheimer's, there is a hereditary component, but Alzheimer's is multifactorial, right? And I'm not going to get into all the factors because I'm flying by the seat of my pants. And so it is important to know what type of dementia a person has, because there are other types of dementia that are actually more hereditary, like truly hereditary, and frontotemporal dementia is one of those. The people who have frontotemporal dementia tend to have a very strong hereditary component to them. They can track that gene, and as to why, so in your family, when you look at it, your mom had dementia, your sisters have dementia, two of your aunts have dementia. There are a lot of things that jump out at me when I read that, Ralph, is, a lot of things. So if we just even go back to Dale Bredesen's book about the end of Alzheimer's disease, right? Your mom and your aunts may have all grown up in the same place. They probably grew up in the same time frame. Okay, so what else was going on? What was their diet at that time? Was there something in their environment that they all got that was toxic? Did they not get certain nutrients when they needed to get them? There's so much that goes into that, and it's very interesting to me because, people always just think about, genetics. Well, there's way more in this that goes into this than just genetics, right? So your mom had dementia, your sisters have dementia, two of your aunts have dementia. Are they Alzheimer's? Are they frontotemporal? Were they all the same? Then you got to throw into it things like vascular dementia, right? Vascular dementia is very, very common in women, because, there's so many things. So Samantha, give me just a second. I'm going to hop on Amazon here. I can type and talk a lot better these days than what I realized. The book is called The End of Alzheimer's. And I'm going to put the link in there. It is a truly, truly great read. I would strongly say, Samantha, I would strongly encourage you to read the book. Obviously, the higher, or the sooner, the earlier we identify that we are having changes. And this is where my frustration comes in, right? My background in training, I'm an occupational therapist, and so that's my background in training. And the thing that frustrates me probably the most is how afraid people are of having their cognition tested when they are starting to have changes. We have, as a society, such a stigma, and as a human being, we realize that our thinking processes are what make us individual human beings and unique, right? We all have a body, we have a heart, lungs, kidneys, stomach, all this stuff, right? Our brain is what even though we all look a little different, etc., our bodies function fairly well in certain ways. But our thoughts and we are made of a body and a soul, right? Every human being has a body and an eternal soul. And so our body, our thoughts and our brain and so on our thoughts are not physical, right? They're not physical. They're kind of like the internet, right? You can't see all these, my voice coming out here, going into this camera and woof, into the right infinity and beyond. What I've just done today on this is going to live in immortality as long as there's an internet, right? So all of these things, I think because we know to an extent that our brain is what keeps us as being individuals and keeps us living independently, we are petrified. People are petrified of admitting that they are having trouble with their thinking. And so because of that, if you're like me, and I got an itch on my nose, I got to take care of that real quick. If you are like me, I'm in my early 50s, and my mom has vascular dementia. She had a stroke in her early 40s. My dad and mom have used alcohol extensively through their lives, and there is such a thing as pickled brain syndrome. People who drink too much alcohol get, my sister calls it wet brain. I call it pickled brain. The technical term for it is actually Korsakoff's dementia. I think they've changed the name over the years. It may have a different name now. But if you, like me, I've identified that if I keep down this track, I've lost 40 pounds over the last year because I changed my I died. I read the book, The End of Alzheimer's. I'm trying to live a healthful life. I have not done any of the, the genetic testing or the cognoscopy. Well, I've done parts of the cognoscopy because I want to be able to protect my own cognitive capacity. What I noticed about in December, it'll be 2 years ago. I was working 70 hours a week. My daughter was getting married. We cash flowed their wedding. I was stressed out of my gourd, and I was not thinking properly. And so I encourage people, don't just slip it under the rug. If you are having trouble, there are things that we can do, and I certainly have access to some of these tests. So if you are in that position, please reach out to me and we can set something up. I totally, Vince, as well, recommend The End of Alzheimer's. The summaries are good. I of course enjoyed reading the harder stuff because it was very interesting to me. And so let me just finish with Ralph's comment here, and then I'll go back to Eunice, okay? The End of Alzheimer's, your wife and you have recently changed your diet to a vegan lifestyle. Just make sure you get enough fat, okay? Fat is our friend. She too has lost an aunt who suffered from dementia and also has other relatives who have it. Dementia is very frightening to me personally, and you and me both, and you worry about your chances for getting it. It's something I think about every day, though I try not to. I would want to be a burden on your wife or anybody else taking care of me, whether I was home or in a facility, should you ever get dementia. All right, so Eunice, after you have breakfast, so Eunice's question earlier was the following: when your loved one faints and falls down, how can you help them get up, get mobile even if they're bigger than yourself? And I asked her a follow-up question. So she said, after we have breakfast and her pills, we went for a shower. Loved one was standing in front of the shower and just faint and fell down, and she was out for a few minutes. She was laying on the floor. She had no balance. She had no balance when you tried to pick her up. She told me that her heart is racing, and she did not feel herself. Okay, so Eunice, a few things I want to say about that. First thing is, if somebody like that passes out and you don't know what's going on, call 911. It could be a stroke, right? She could have had a stroke. I don't know whether that my x-ray vision does not work that well. So first thing is, look to see if she, if especially if it took several minutes for somebody to come around, I would call 911. Second thing is, if it wasn't a stroke, or if, they came around, did her blood pressure drop? So are you taking your loved one's blood pressure? Take it sitting, have her stand up for 30 seconds, take it in standing, see if it has dropped. If it drops more than 30 points in either the diastolic or the systolic, it could be an indicative of orthostatic hypotension, which just means as you stand up, your blood pressure drops and you pass out, right? So orthostatic hypotension. The third thing that it could be, Eunice, that jumps out to me today is that it could be a medication. Is she taking medicine for blood pressure, but her blood pressure is not high anymore? Is she taking another medication that has the side effect of people passing out? So there are lots of those kinds of things that could be you could be doing. So how to get somebody up off of the ground if they've fallen. So we'll talk about that briefly. Okay, good. I'm glad you did the FAST. What is the FAST? F-A-S-T. So we'll talk about that real quick. So FAST, for anybody out there watching, if you don't know, is a stroke screening. It's called FAST. the fast protocol. Face, do they have drooping? Right? Arms, does one arm lag when you say lift up your arms? The third one, FA, face, arms, speech. Speech and swallow, actually. If they have any trouble, getting their words out. And the fourth one is time. Time, FAST. That's the so we did 2 fasts today, the functional assessment staging tool and then the fast stroke protocol. Faces, arms, speech, and time. Time is brain, and so time is brain in the sense of a stroke, because there are medications out there that from time of onset of symptoms to time of administration of drugs is less than 4 hours, right? From time you notice something to time you get your butt into the hospital, they've diagnosed you that they can give you this medicine. Face, arms, speech, time, right? So that's the stroke screening. That's a stroke screening. And time is brain. And time is brain in the sense of dementia too, which is why we want people to be diagnosed earlier on. So Ralph asked, yet again, back to how to get somebody off the ground, right? So what you do is there are 2 types of falls, right? The first type of fall is, I fell and I got hurt, call 911. I broke my hip, I hit my head, all of these kinds of things. So that's the first one. The second type of fall is the fall, I fell on the floor, my dignity's hurt, but I have not hurt myself. And how you get somebody off of the floor for that is you have them crawl or butt walk, butt scoot their booty across the floor to a sturdy piece of furniture. Okay, then you have to try to get them on their hands and knees in front of the piece of furniture, then have them bring their strongest leg up to a half kneeling position, so arms up on the surface, a desk, a table, a bed, a couch, a sturdy chair. Get their 1 foot up. You grab a hold of their breeches, like hands on, hold on to their breeches, and you say 1, 2, 3, get your other, help them stand up, and then you turn and sit them right down. You don't try to walk away from where they were at, and then you assess them again and see where they're at. So that's how to get somebody off of the ground if they've fallen. If they have fallen and they really cannot do that, the other alternative other than 911, if you have enough people you can get somebody off of the ground, you have to go get a sturdy sheet, a quilt, something like that, not something that gives, but something that will hold, right, that doesn't, when you pick them up with their weight, drop. And then you slide it under them, you get it under their bottom like a hammock, and then you get, if you have enough people, you can, try to slide them across the floor like a fireman, literally slide them across the floor to a chair, put their back up to the chair or the bed, whatever, and then you get 2 or 3 people to stand and hold onto the hammock that you've now created and lift them up onto the bed or the chair. And that's how you get people off of the ground. But sometimes you need to have enough people. So to Ralph, yet again, beautiful question. I love this. And what a controversial question that you have asked. What are my thoughts on this recent controversial FDA-approved drug for Alzheimer's treatment? Do I think it'll be of any help to people who have dementia? So Ralph, that is a super great question. I have no idea. I honestly don't know. And the reason I say that is because, to be honest with you, I've just started reading about it. It just came out this week. There's a lot of controversy around it. A lot of the people at the FDA have resigned over this because they don't know that it's effective. The drug itself costs $56,000 a year. $56,000 a year. And the little bit that I read said that you have to be on this drug for 78 weeks. That's a year and a half almost, right? 52 weeks in a year. So 78 weeks before you may or may not see whether or not it helps. So if we go back to what we were talking about earlier, right, about some things being multifactorial, and some disease processes being have one factor. So Pneumonia, right? You get a the cold, a virus, you have one factor. If you read the book, Ralph, and I would strongly encourage, since you know from your previous comments about you and your wife trying to change your diet, etc., I would read the book The End of Alzheimer's and then make a decision about it, because The End of Alzheimer's identifies 36 factors. So a monotherapy, which is a drug is always just a monotherapy, plugs up one of 36 holes. So say Aricept and Namenda and all of these other drugs that we have out there right now to slow Alzheimer's down, right? Because that's all they do is slow down the process. They don't stop it. If all of those drugs, those monotherapies, are plugging one hole, but we haven't done anything about the other things like inflammation or blood sugar or infection or toxicity or hormones or all these other factors that contribute to dementia, then this particular drug is only going to plug another hole. Now, may or may it not be effective to plug that one particular hole? Yes, probably so, potentially so, right? But if we believe as society, and this is truly what I believe, if we believe as society that we're going to fix dementia by giving a person a drug, we are sorely misled, because dementia is not something that's just that easy. It's, you know, in my practice, most people who have dementia have diabetes, blood sugar, right? Most people who have vascular dementia have a cardiovascular problem, which is caused by, if you go look at some of the research on cardiovascular disease, there's actually a study that was done in Finland, which is of an interesting thing. I forgot what the name of the study is, but it was done in Finland in a community where, guess what they did? They recognized they had extremely high incidence of cardiovascular disease. So what they did is they decided as a community that they had high cardiovascular disease, and people smoked. Okay, so they did a 30-year longitudinal study where they modified lifestyle. Guess what? 30 years later, their incidence of death because of cardiovascular disease went boom, down. And all they did was lifestyle modification. Lifestyle modification. People, their cardiovascular disease risk went down, their blood sugar went down, people stopped smoking, they started exercising, all of these things. And we as a society, we as a actually pretty much in the entire world, right? We want everything to be convenient. We want to be able to take a pill and say, oops, I've lost 10 pounds. I didn't have to do nothing about it, right? Well, guess what? In order for us to be able to do these things, we're going to have to change what we do. So, Ralph, you're on the right track to doing that. Read the book, The End of Alzheimer's, because it'll give you so much information regarding you know, what to do, which things to change. So yes, back to what I think about this FDA-approved drug for Alzheimer's. I honestly don't know. I think it is something that can change things for one person, but I don't know that it's going to change things for everyone, and I don't think that it's going to necessarily be enough, because I think dementia is way more complex in what causes it, and therefore we need to have a more well-rounded approach, and lifestyle modifications, diet, exercise, sleep, and stress, lifestyle modifications. So yet again, thank you for joining me. What a great program to get today. Thank you for you guys for coming. There are 3 ways primarily you can reach me. You can message me on Lizette Kluta OT, and some of you guys have messaged me before. Please continue to message me. You can join my Facebook group called Think Different Dementia, where I do a second program once a week, where I actually pick a topic and then we go into that. It's typically between 40 to 60 minutes. I'm still trying to find my groove. And then you can subscribe to my YouTube channel called Think Different Dementia. These videos go on there once a week, so you can actually, if you miss this in the live stream, then you can go back and watch it. So as I end all of my programs once a week, thank you for joining me, guys, and the Lord bless you and keep you, and I will be back again next Saturday. Today is Saturday. It is June the 12th. Oops, excuse me, I'm dropping things. And this was the Baffled Brain, Demystifying Dementia, the weekly hour-long Facebook Live that will teach you everything you want to know about how to manage dementia. Today is June the 12th, and this was episode 28, and I'm your host, Lizette Clute from Think Different Dementia, where we believe caregivers deserve reliable and accessible answers to their questions, because providing caregivers actionable strategies, reliable information gives them and the person with dementia their best quality of life, improves their relationships, and delays their decline. Thank you for joining me, guys. I will be back again next week, and the Lord bless you and keep you. Bye.